And I would wish to say that there is no health without mental health. And mental health, more often than not, we tend to think it's synonymous with mental illness or madness. But the truth is, mental health is more than the absence of a mental illness. Now, we are talking about correctional services, and we are talking about specifically the probation officers, the prisons officers, and the inmates. But why are we looking at their mental health? Because mental health is an integral part of our health. And when we don't take care of our mental health, it ultimately affects our productivity. And so as you speak about the probation officers or the prisons officers, research has shown that they go through a lot of stress. And part of it is traumatic. Listening to those stories, even the inmates, what they have gone through, it's quite traumatic. And this, at the end of the day, it affects their mental well-being. And we are looking at how best can we help the officers as well as the inmates to thrive despite the environment that they find themselves in. That mental health conditions such as depression, anxiety, and stress-related disorders, they affect or they reduce our productivity by 5 to 10%. So if you want to boost the productivity of our officers, then we need to address their mental health. And that's what we're talking about. How can we boost the mental health and wellness of the officers as well as the inmates? And once we do that, then we are sure that they are able to thrive despite the challenges that they go through in their various environments. At Chiromo, let me say that we've been honored to partner with the Kenya prisons as well as the police. And we have a program with AMREF, we call it Advanced Diploma in Mental Health Practice, and we've had the privilege of partnering with the Kenya prisons as well as the Kenya police. And we have sponsored a few psychologists or counselors to be trained further training on mental health. The number two, as CHG, we are glad we've been involved in creating awareness on matters mental health with the Kenya prisons as well as the Kenya police. And we are looking forward to more partnership, because when I talk to one officer and that officer speaks to another officer, then the ripple effect is that the society will be a better place for all of us to live.
So we look at not just the prisoners themselves, but also the people working